We're calling it the Great Healthcare Plan. Instead of putting the needs of big corporations and special interests first, our plan finally puts you first and puts more money in your pocket. The government is going to pay the money directly to you.
So President Trump there unveiling what he is calling the Great Healthcare Plan, and he is calling on Congress to approve this. This plan would send money for healthcare directly to Americans, allowing them to buy the insurance of their choice. It also focuses being more upfront with the public about healthcare prices, about revenue, rejected claims, and wait times for care. The president is promising that with his plan, premiums will be cut, drug prices will go down, claiming that Americans will get a better deal and better care. The pitch coming as healthcare costs have just gotten more expensive year after year, even after the Affordable Care Act became law during the Obama administration. And the commander-in-chief perhaps got inspiration for this new proposal from our next guest. The president actually posted his thoughts on healthcare to his own Truth Social page just a few weeks ago. And he joins us now, the director of health policy studies at the Cato Institute, Michael F. Cannon. Michael, really appreciate you taking the time. And what's your assessment on Trump's plan? Is this a silver bullet we've been looking for?
You know, if I were talking to the president, I would say the best part of the plan is allowing more over-the-counter medicines that'll reduce prices. We've advocated that at the Cato Institute, eager to work with him on that. Turning Obamacare subsidies into cash subsidies for enrollees, though, would unleash countless problems. It would expand Obamacare, and it's really like trying to knock in a short putt with a lawnmower. It just doesn't make any sense. If the president applied that idea, it's a bad take on a great idea, though. If the president applied that idea to employer-sponsored insurance, then he could be a bigger tax cutter than Ronald Reagan and give people better health insurance and medical care. And the one thing that I would add to the president's plan is I would say that he should push Congress to make permanent the additional consumer protections or remove the barriers to consumer protections in Obamacare exempt plans, which is what he did in 2018. That was a huge success. And when people learn that Obamacare's pre-existing conditions rules are basically just rent control for health insurance, reducing the quality of health insurance, they oppose Obamacare's pre-existing conditions rules 2-1. So the president can even win on that issue rather than just make it even bigger mess out of Obamacare than it is.
So let's talk about this proposal of letting consumers control the money. Let's take a listen to how White House Press Secretary Carolyn Leavitt is describing it.
This plan, once put into legislative text and passed by Congress and sent to the president's desk, will stop sending big insurance companies billions of an extra taxpayer-funded subsidy payments and instead send that money directly to eligible Americans to allow them to buy the health insurance of their choice through, you may have heard it be referred to as health savings accounts.
So that sounds pretty good. I mean, can you break down to me about how these healthcare savings accounts would work, how this would work for Americans, and then what's the problem that you see with this?
Ms. Leavitt's talking about taking the money that Obamacare is giving to insurance companies and giving it to enrollees. And individual consumers controlling the money, that's what we want in healthcare. The problem with Obamacare is that the population of people who could be eligible for Obamacare subsidies is about 4 times the size of the 4 times the number of people who are currently receiving them. So I predict that if Congress did what the president is advocating here, then Obamacare spending would increase, and probably former President Obama would be cracking himself up that the president expanded his signature plan. A much better approach would be to take that same great principle and apply it to employer-sponsored health insurance, which would allow workers to control $1 trillion of their own earnings that employers currently get to control. And that, letting workers control that much money, would be a larger share of the economy than President Reagan returned to workers through the 1981 tax cuts. That would make President Trump an even bigger tax cutter than Ronald Reagan.
Okay, so you've convinced me with this. What would prevent President Trump from doing this? Why wouldn't he go ahead and make that change?
So there, I don't know. I mean, there are legislative obstacles. Certainly, it's tough getting anything through Congress, but we've had decade after decade of government taking control of our healthcare dollars and decisions and giving that control to employers, and it's just not working.
Insurance companies are very powerful. How would they feel about the plan you just put forward?
They love having lots of money go straight to them. They loved Obamacare, they love Medicare, they love Medicaid because it channels trillions of taxpayer dollars to them with almost no accountability, which is why if you give Medicare spending to the enrollee, I think the idea works there, that would impose far more discipline on insurance companies and the health sector than the current Medicare system, which really lets the industry run the Medicare program. And the same thing applies to employer-sponsored insurance. Employers aren't very good at choosing people's health insurance, and employer-sponsored health insurance, by its nature, is lousy, low-quality insurance because it disappears when you change jobs, maybe after you or a family member gets sick. So if the president lets people control that for a typical family, it's $27,000 of their earnings that employers get to control. They'd be able to buy portable coverage that stays with them between jobs, and the problem of pre-existing conditions gets smaller, and Obamacare seems less necessary.
Okay, so one more question for you. Democrats on the other side saying that this proposal is vague, risky, and could make health care much more expensive for millions of Americans in the long run, especially after Congress lets ACA subsidies expire, which is already pushing premiums up sharply. They're arguing that shifting federal money into individuals' hands will not offset rising costs and could leave lower-income people worse off or without real insurance. What are your thoughts on that?
So Obamacare subsidies for the wealthy are disappearing, but Obamacare subsidies for middle-income enrollees are still there. And that's not increasing premiums when subsidies disappear. The premium stays the same, basically, but the share that the enrollee has to pay goes up, and Democrats want to hide that. Obamacare's premiums are so expensive. But look, in the president's plan, there are things for Democrats to like. Democrats like the idea of removing unnecessary government-imposed prescription requirements. They should be able to work with the president on that. And they should be able to work with the president on letting workers control the $27,000 of their earnings that employers currently get to control, because when you do that the right way, it achieves a lot of Democratic goals as well. Some of the goals of the Cadillac tax and Obamacare, but also it's a huge tax cut for low-income workers and lets low-income workers control their health insurance decisions. At the same time, it reduces healthcare prices for low-income workers, and that's the most important thing we can do to make healthcare more universal.
I appreciate you coming on tonight. Michael F. Cannon, thank you so much.
Thank you.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.